In our top story tonight, South Carolina health officials expand access for a COVID-19 treatment. They say monoclonal antibodies are keeping people out of the hospital. Well, tonight, Jason Raven tells us why officials say this should not be used as a substitute for vaccination.
According to the State Health Department, as of the beginning of this month, more than 16,000 people in South Carolina have gotten monoclonal antibodies, and they estimate the use of this treatment has kept 2,000 people out of the hospital and prevented more than 200 deaths. Now, doctors have been using monoclonal antibodies as a treatment for COVID-19 since last November. Now, the FDA granted emergency use authorization for these lab-designed antibodies in people who test positive for COVID-19 over the age of 12 and weigh at least 88 pounds. Now, doctors say they work by blocking the effect of the COVID-19 virus in patients who are already infected.
It is remarkable how effective monoclonal antibodies can be in preventing progression of COVID-19 to severe disease.
DHEC and Governor Henry McMaster are encouraging the use of this treatment in South Carolina, especially for those South Carolinians most at risk. Now, Assistant State Epidemiologist Dr. Jane Kelly says this is an important tool in treating COVID-19.
If you get COVID-19 and you're older than 65, or you have multiple medical conditions, or even if you're just overweight or obese, monoclonal antibodies can help prevent you from progressing to severe disease. The other thing to know, though, is you have to get them within 10 days of symptoms or within 10 days of testing positive if you don't have symptoms.
Dr. Kelly says this treatment should not be seen as a substitute for the COVID-19 vaccine.
They give a boost to your natural immunity, but they only are temporary. They last about 3 months and then they're gone out of your system. You do not have those memory cells. You do not continue to make antibodies the way you would with vaccination.
She says vaccination is the best way to prevent severe illness and strongly encourages all South Carolinians who are unvaccinated to get the COVID-19 vaccine as soon as possible. DHEC says they are working with providers to expand treatment locations, including areas where there are no providers right now. In Columbia, I'm Jason Raven.